Having an episode of angina can be upsetting and painful, but the good news is that there are many different ways to prevent and treat angina. Since angina is usually caused by underlying coronary heart disease, steps taken to prevent major heart disease also help to prevent angina. To get started, quit smoking and avoid secondhand smoke. Maintain a healthy body weight, which means having a BMI between 18.5 and 24.9. You can check your BMI easily with an online BMI calculator. Get plenty of exercise. In general, aim for at least 30 minutes a day, 5 days a week. But check with your doctor first to make sure exercise is appropriate for you. This is especially important if you already have angina. If you drink alcohol, limit yourself to no more than 1 drink per day for women and no more than 2 drinks per day for men. Also, get checked and treated for anxiety and depression, since both are linked with increased frequency of angina. Follow a healthy diet. That means one rich in fruits, vegetables, and whole grains, as well as lean proteins like chicken, fish, beans, and legumes. Avoid high-fat dairy products like whole milk, cream, and cheese. Lower your intake of salt and stay away from bad fats, meaning saturated and trans fats. Other lifestyle changes that might help if you already are diagnosed with angina are resting after an episode, avoiding triggers including large meals and rich foods that leave you feeling uncomfortably stuffed, learning to avoid stressful situations and dealing with stressors you can't control will also help control your angina. In addition to the lifestyle changes you may make, your doctor may prescribe medication. There are 4 main types of medication that are prescribed to control angina: nitrates, beta blockers, calcium channel blockers, and ranolazine. The type and number of medications prescribed are dependent on how frequently angina occurs in 1 week. The first medication typically used is nitroglycerin. Nitro is used during an attack to relax and open the blood vessels around the heart, allowing more blood to flow to the muscle. This medication comes in different forms. Sublingual, or under the tongue, is short-acting, while pills or a skin patch are longer-acting. Beta blockers can be used to slow the heart rate and lower blood pressure, reducing strain on the heart and in turn decreasing its oxygen demand. Calcium channel blockers are used to relax the blood vessels of the heart. This also reduces strain on the heart while allowing more oxygen-rich blood to flow to the heart muscle. Ranolazine, which is a medication that calms the heart and improves blood flow. It can be used alone or in combination with other anti-anginal medications. Lastly, aspirin may also be recommended, but not for the treatment of angina per se, but to help prevent heart attacks by reducing the risk of blood clots forming, which is a risk with narrowed arteries. While these medications are effective in treating the short and long-term symptoms of angina, they do come with the risk of side effects. These can be mild to severe, vary for the different drugs. For example, beta blockers can cause fatigue, and they will vary for different people. So it's important for you to know the side effects you are having and to tell your doctor. Finally, your doctor might also suggest a surgical procedure called angioplasty to open the coronary arteries. This may be recommended when lifestyle and medications aren't working well enough. During this procedure, a long wire with a balloon attached at one end is threaded up to the narrowed section of the vessel. The balloon is then inflated to open the vessel. In severe cases, a coronary or heart bypass procedure may be done. Angina can be confusing, so don't be afraid to ask your doctor questions. Ask your doctor about how to best control it. Ask if there are limits on physical activity, and especially ask when it's time to seek medical attention. It's helpful for you to figure out the usual pattern of your angina if you have it regularly, and to keep track of what medicines you take. Any change in the pattern is a reason to see your doctor. Angina isn't the same as a heart attack, but it does mean you're at increased risk of having one. The risk is even higher if you have unstable angina. So, taking steps to prevent angina and heart disease can save your life. Thanks for being part of Healthy Nation.